Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
We're in our wheelhouse here,
Yep,
Dr. Wiening, as
directly.
a couple of orthopedic surgeons. We're going to be talking about
What to expect on post-op day one after a knee replacement.
it's kind of like what to expect when you're expecting,
Yeah.
but you don't get any baby after this one.
That's right. I was going to say there's no crying, but there
crying.
might be
There's
crying,
crying.
unfortunately.
There's crying.
And we're not saying that to be insensitive.
No.
So this is a big deal. So congratulations. If you are post-op day one and you're watching this video, congratulations. You're through the hardest part.
Condolences, you still got a lot to go.
Yes, but you probably waited, especially in Canada, you probably waited a long time. You might have been canceled a couple times because of COVID, but you got through the operation. Congrats. Now it's just...
Canceled in a good way.
Yes.
I mean, canceled in the way you didn't get your surgery, not
Yes,
canceled.
not canceled like Jake Gyllenhaal.
Is he canceled?
Yeah,
Really?
100%. Yeah, because of Taylor Swift.
Oh, my
Whole nother,
God.
nother story.
She did that whole video about it.
Yeah.
Yeah, I saw that.
Yeah.
That was a long video. But it was good.
Yeah.
I was going to say this is an important video because a lot of people are going home
Yes.
same day. They're
Right, so you might have had surgery today.
Yeah,
Yeah, so you're not even day one. You're watching it early. Way to go.
day zero.
Day zero. So, there's a whole bunch of things you're going to be feeling, and we're just going to talk to you about what are the most common things and let you know that almost everything that you're feeling is pretty normal and pretty common and just part of the process.
A few things to watch out for though, for
Yes,
sure.
for sure.
Chest pain,
Yep.
shortness of breath.
Yep.
Those are kind of worrisome things that there may be a complication.
Or a very severely draining wound, either lots of
Yeah.
blood or, heaven forbid, pus.
Yeah. Bit early for pus,
Yep.
day zero or day one, but certainly too much blood coming out of that wound. Those are things to worry about.
Yep.
Or a lot of calf pain and tenderness.
Yeah, and pain that's increasing, like getting
Yeah.
worse, and despite all of your medication,
Yeah.
that your pain medication is not touching it. So
Yeah, those are some red flags.
Go to the ER.
Yeah, go back, get medical attention.
Yeah.
But if you don't have those red flags, a whole bunch of the next stuff we're going to talk about are just white flags.
And this is not because we're clairvoyant, it's because we've seen so many of you in our practice. So I'm going to start, and I'm guessing that today you're feeling like you had a pretty bad sleep last night.
You didn't sleep well. No, you
For
didn't
a-
sleep well.
For a host of reasons.
You got a lot of medications
Yep.
during the surgery from the anesthetist, from us to go home with, and things that just interfere with your sleep.
Yeah, it's uncomfortable. You can't find a comfortable spot. You probably are sleeping on your back because you don't want to lie in the incision, and your side is a little bit awkward.
You may
so
not even be in your own bed because you couldn't get up the
that's right.
stairs.
You might be on the couch or in a
Yeah.
recliner,
Yeah.
whatever.
And you may be in a ton of pain. That's why you didn't sleep.
I think there's a real chance of that.
Pain is guaranteed.
Yes.
Okay, in the first day.
100%. So your pain is normal, like we talked about before. As long as your pain is managed with the medication, it's not going to take it to zero. As long as your pain is not drastically increasing, what you're experiencing is probably normal. And then use the strategies that your surgeon has provided you with to control it as much as you can.
Okay, so you didn't sleep well, you're in pain, and your leg is pretty swollen.
It is very swollen.
Just
You,
had surgery.
you look down and you think, that doesn't even look like my leg. It doesn't match my other leg.
Basically, you feel like you have a hangover.
Yes.
But you didn't have the fun night before. You wake up with a hangover with some unidentified party injuries. Well, these injuries are identified.
Yes.
It's surgery. So, bad sleep, pain, swollen leg.
You may actually be feeling a little bit of regret, wondering, did I make the right choice? And this is very common.
Yeah.
I see this in early on, especially when you're around the first couple of days in the hospital. You're like, boy,
Yeah.
I'm not sure this was the right idea.
Yeah.
Or when
Yeah.
people are really honest later on, they explain, the first couple of weeks, I wasn't sure, maybe I shouldn't have done it. So that's very common.
You probably don't like us very much. You don't like your surgeon very much.
You don't. And I've read that too, where they're like, I hate him,
Yeah.
right now, just in the moment.
Yeah.
But yeah, so
Yeah.
the regret is actually very, very, very common.
And along with this, pain, lack of sleep, regret, poor mobility. You can't get around on
Yep.
your own, right? You can't use that leg if you had a knee or a hip replacement, certainly if you had a shoulder replacement or an elbow replacement or some major surgery somewhere else.
Yep.
You can't get around very well, so you're not as independent as you were.
Yep. I'd say the next thing that first day is you don't have much of an appetite. You haven't ate maybe for 2 days, but the medication kind of makes your stomach sore. You're maybe even a little bit nauseous. So you've lost your appetite. You're lying there thinking, I'd love to eat something, but I just don't feel like eating anything.
No, that's the last thing you feel like.
Key to try to stay hydrated if you can't eat. Don't get too far behind and do your best just to get something down.
Yeah. And the thing you have been hopefully able to get down is your medications,
Yes.
right? And so they might make you feel a little bit off. A lot of
Yeah.
the side effects of these narcotic medications is that you just feel a little bit dizzy, you don't feel yourself, you feel confused, some people get hallucinations.
Yep.
So you feel kind of off because you're taking all these narcotic medications.
Yep. You may be looking down at your leg and you might even see a little bit of blood soaked through your dressing. A small amount is not uncommon and it's not dangerous. Obviously, if your dressing is totally soaked, that's more concerning. So some people are there and they're experiencing a lot of anxiety or apprehension about what the heck's under that dressing or why is it coming through? And you've probably been given guidelines by your surgeon as to when to contact them. But obviously, if it's a small amount of blood and the blood is dry, that's not uncommon.
Okay, now if you have a partner, they probably still love you, even though you may not think so at the time, because you need help from someone. Often
Yes.
you need help. And if you have someone at home with you, a family member, they're going to be helping you, hopefully, because you're going to need some help in that first day zero, day
Yep.
one. You wouldn't want to go home alone the same day as surgery. I'm sure some people do, but
Yep.
that makes it a lot harder. So you're going to be reliant on someone.
They love you, they just might not like you right now.
Yeah.
Yeah, you've lost that independence that you're talking about.
Yeah.
I'd say the other thing that's really different is that you're uncomfortable, you have pain, you had a bad sleep, you're hungry, and now someone's telling you got to exercise.
Ooh.
Even on the best of days, when you feel
Yeah.
really good, you're like, I don't feel like going to the gym, or I don't feel like doing my regular exercise routine. And now someone's saying, not only do you have to exercise, but you have to do the single exercise that hurts the most.
Yeah.
You got to bend that leg that
Yeah.
causes you more agony,
Yeah.
which is normal and critical.
Yeah. That's a tough one because you have to get moving, right?
Yeah, we can't emphasize that enough.
Yeah. I mean, you feel like just lying around doing nothing, but you've got to get up and get moving.
Yeah.
You know what? I really hope we haven't dissuaded anyone from going ahead and having.
We should say you're not allowed. You have to prove that you had surgery to watch
Yes,
this video.
Don't watch this video if you haven't had. We should have put that at the beginning, really.
Yeah.
Please watch the end of this video before you watch the beginning.
That's right.
Because go ahead, have your surgery. But these are the things that we're just telling you that you're going to feel. And we're trying to tell you them so that you feel better, so that you feel a little more normal, that you're not the only person going through all these things. And it's normal to experience all these things.
Yes, it's hard. It's a really, really hard, by far the hardest operation that we do.
Yeah.
I just think the last thing is that now when you walk really differently, right? Because that
Yeah.
leg's heavy, it doesn't move properly. You're using a walker probably, sometimes a
Yeah.
cane or crutches. So just go slowly, do your best, be very intentional. Getting out of bed is awkward. We actually have videos that tell you how to get out of bed. That's how difficult it is. So
listen, now if you've had this experience and you've gone through this and we missed something, please put it in the comments.
Yes.
Okay? Because you sharing it with other people will make them feel better as well.
validation
All right?
for the masses.
Yeah. Validation for the masses.
Yeah.
So put that in the comments. Tell us your experience about this. We might have missed something, but this is generally what we hear people say when they go home or when we round on them on the first day.
Yeah.
So you may be in the hospital on your first day, you may be at home on your first day, but you more than likely will be feeling a majority of the things that we just mentioned.
Yeah, but it's hard. You're getting there, you already had the surgery. Each day is going to get better, and there is certainly hope on the horizon.
That's the good news.
Yeah.
These feelings that you're having and experiences you're having are not permanent, okay? They will go away. They'll
Yep.
get better. I tell people every day it feels better and
Absolutely.
better. Until day 3. Day 3 is a tough day.
Okay.
Beyond that, things start getting better and better and better and better.
There you go. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.